Hello class, I'm Dr. Upasna and today we will be discussing a new YouTube short. Before going further, we will brush up our some knowledge on the case. So, I have given the case of Acrania, Exencephaly, Anencephaly sequence. What is it? It is a progressive cranial neural tube defect which starts from the process of acrania, leads to exencephaly, which is a transitional stage, and then further lead to anencephaly. And it starts from where? It starts by failure of cranial vault formation, which will further expose the brain tissue and lead to degeneration. So the embryology is that neural tube closure occurs at the day 25 to 28. Now the cranial neuropore won't fuse and this will lead to absence of calvarial formation. So our brain tissue will get exposed to the amniotic fluid and which will act as a chemotoxic agent and which will further lead to this degeneration of the brain tissue. So in ultrasound, if in early stages you will find acrania. What is it? There will be absent calvarial bone, but you will see that there will be some floating brain tissue. Irregular cranial contour may be there, and one more thing is that there will be normal facial features. You will see the normal nasal bone, you may see that there is normal mandible and maxillar tissue. So it is the earliest detectable stage. Exencephaly have the large amount of exposed brain tissue, and this is just like a transitional stage. Here in anencephaly you won't see any brain tissue. There won't be any cerebral hemisphere because it has all degenerated and it has mixed with the amniotic fluid. So you will find lot of echoes in the amniotic fluid. So polyhydramnios is also very common feature. Why early diagnosis matter in this case? Because it is a lethal anomaly and no postnatal survival is there. So early you diagnose, early termination is possible, psychological preparedness will be there, genetic counseling you can advise. As there is also a risk of recurrence, so there should be prevention measurements in future pregnancy. Recurrence risk and risk factors are, recurrence risk is 2 to 5%, and the risk factors that you should know, you can ask the history of the patient like folate deficiencies, valproate, maternal diabetes and previous entities. So here in this case we usually give in the next pregnancy extra folate as a prophylactic in the prophylactic dose. So this is the case I had shared, and here you can see that there is no brain tissue which is floating in the this jet black amniotic fluid. This is a frog eye sign, and see there is no brain tissue. If you will be able to see brain tissue, then that is only exencephaly stage. And here I have shown one video. See the fetus is moving. There may be swallowing because the brain stem is intact, but the cerebral hemisphere has all been degenerated. So there is nothing here, and this is the cranium and this is the face. So facial structures are intact. Eyeball is there, nose is there, the mandible is there. I hope you like the series, and I will bring further of the cases and will share the answers of the other YouTube shorts also. Thank you.